in Allah Ta'ala tentubala. Abra tuwabole apole ko. It's better. It is late. It is late. It is better than. It is better late than never. Olenga kaya barso jambe alhamdulillah. MRC itulumuna badi wole kinterolem. Gambia be terilem. Meta bag Gambia. Itolle fanam koita. Nenka sasa ila sasa jibe ayalong. Jara wala koita muti nango kes ake jara figente yato. وبين الإنبار باك الله تعالى يكتب باك. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. آمين. اللهم إنا نسألك بأنك أنت الله الذي لا إله إلا أنت يا حي يا قيوم يا حنان يا منان يا بديع السماوات والأرض يا ذا الجلال والإكرام لا إله إلا أنت سبحانك إنا كنا من الظالمين. واستجب دعواتنا بأنك أنت الله لا إله إلا أنت يا أحد يا فرد يا صمد يا من لم يلد ولم يولد ولم يكن له كفوا أحد. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب. اللهم يا صل على محمد وآل محمد كما صليت على إبراهيم وعلى آل إبراهيم وبارك على محمد وآل محمد كما باركت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. اللهم كن خير باتي اللهم كن نعمتي اللهم كن خيرتي اللهم كن نعمتي اللهم كن جاد كندياتي اللهم لكم بسنا لكن فين كل يا رب العالمين. اللهم رب سلم بس.
English ladies and gentlemen, members of the high table, I greet you all. We are here because of the community, the mothers, the fathers, the children, the parents, and I greet you all. This morning, I am here on behalf of Ed Clark, who is away at the moment, but he sends his deep regards. And we want to specially thank you for your collaboration, the Gambia government, the Ministry of Health, the officers in charge of the various health centers we go to, especially the Banjulnding community where we find ourselves. We want to give special thanks to the Alcalo of the Banjulnding committee, because without his hospitality, we won't be here today. We also thank our collaborators, the RHT team. We thank the representative of the UNICEF, WHO. We have sponsors that help us fund the trials we coordinate in the Gambia. We also want to give special thanks to the MRC, the staff that have worked tirelessly to make things happen. We appreciate you all. And today I'll briefly talk about vaccine trials and the community we find ourselves in Banjulnding. Banjulnding has been a very hospitable community since we've been conducting community sensitizations. And I can remember vividly our last community sensitization. They offered to give us a place to be able to build this edifice that we are here to inaugurate. And we are grateful that we are here today, witnessing it live and direct. Thank you, our Honorable Akalu. We also want to let you know that we all say health is wealth, and we know that for you to have a healthy nation, definitely you have a wealthy nation. And we have been involved in a lot of vaccine trials, and we know that vaccine saves lives. If we look at the history of previous vaccine preventable deaths, we've looked at polio that killed a lot of people. We've looked at meningitis. We've looked at all those vaccine preventable deaths. And now we've seen that vaccines are very important, and which is why we conduct this research. We have a lot of studies we've conducted, and following my speech, we'll have them come to give us feedback on what they've done. And I just want to implore each and every one of us to sit down, to relax, and listen to the feedbacks that we'll be bringing from various studies, and have a great day. Thank you all.
Alcalo of Banjulnding and other Alcalos present. I live in Burfoot, so special greetings to the Alcalo of Burfoot, the Imam, the OIC of the Health Centre, MRC staff and management, the RHD staff present, media, the mothers and caregivers, ladies and gentlemen, and I also Dr. Nyasi, who's my great friend and colleague at the Ministry of Health. I am delighted to be here today to witness what I call the interface with the community dialogue, which entails receiving feedback and complaints and to come up with solutions that enable communities to take care of their public health. And this goes along with the theme of this open day, which is MRC, government and communities of the Gambia working together for a better public health. This event is all about adhering to the basic community value, the basic core values of community engagement, creating an intersection of open spaces and channels for citizens' empowerment, collective action, and participation with government mechanisms to bring about positive change. This is what UNICEF does. Chairman, recognizing the importance of community engagement in achieving results for children across our strategic plan, its importance as a change strategy in this region globally, we have been working to strengthen this function within our organization and further improving its contribution to our work as well as influencing the work of our partners. UNICEF still maintains a historical and comparative advantage, especially through its footprint, by maintaining its leadership in responding to community needs through community engagement, as was demonstrated during the COVID-19 pandemic. Ladies and gentlemen, let me briefly share with you the unique role UNICEF Gambia plays during the response to COVID-19 in the Gambia through people-centered dialogue approach called Nsakeno. Nsakeno is a Mandinka word which means we can do it. Nsakeno is all about engaging people and communities in creating spaces for them to speak out, raise awareness, and advocate to drive social transformation in behavior and demand within the community. During the COVID-19 pandemic, UNICEF supported communities to develop their own action plans, and in that we had reached more than 1.5 million people were engaged to prevent the spread of the coronavirus. This has contributed to ensuring people take care of their own health by adhering to the COVID-19 public health measures. Ladies and gentlemen, in terms of service delivery, UNICEF recently supported the Ministry of Health in the recently concluded NOPV and COVID vaccination campaign, which made a significant impact to increase the uptake of vaccines with both the NOPV and the COVID-19 vaccination. For NOPV, for round 1, we had a coverage of 85%, and for round 2, we had 105%. And this was all due to the strong community engagement activities. For COVID-19, which we know the vaccine uptake has been quite low in the Gambia, but we were able to also make a steady increase from in December of 13.7% to 18.5% recently, about a couple of weeks ago. And this is all due to our community engagement activities. In conclusion, I would like to encourage all partners and government to reinforce community engagement activities with the inclusion and participation of adolescents, youth, and other community leaders, and that has been manifested here today with MRC, and as they've been doing over the years. It is anticipated that this will connect the duty bearer and holder, promote citizens' empowerment and participation within government mechanisms in bringing about positive change. More so, it will also increase demand for essential healthcare services and change behavior within our communities. I think
to present or represent you in your two previous meetings you had in Brikama and the other one in Fajikunda. Our apologies for not being able to attend. Professor Asenjai, the Alcalo of Brufut, Lamen, and Banjulnding, the OIC of Banjulnding Health Centre, the UNICEF representative, Mrs. Mariama Jane, my colleague, my friend. I've been always giving her a lot of trouble during our meetings, though they have been supporting the Minister of Health for a long period. So thank you very much, Mrs. Jane, for that wonderful job you've been doing. The senior MRC staff here present, study participants, the media houses here present, because they are the ones who are going to help us disseminate this important information for the benefit of the rest of the country. Thank you very much for being here. All protocol duly and respectfully observed. Good afternoon to you all. I don't want to bore you with a long speech because I know you've been sitting for a long period, but one thing is certain and is sure is that MRC has been contributing a lot for the development of this country and to strengthen our health care delivery in this country for many years. Their contribution cannot be underestimated. I remember since the outbreak of COVID-19, one of our strongest partners in COVID-19 response is MRC, and they are still supporting us. And when we are tough in making decisions in how to conduct our COVID tests, our first point of call is MRC. And when we knock their doors, they are always ready to respond. So on behalf of that, I would want Professor Jan to extend our thanks and appreciation to Professor Umberto for that wonderful contribution they have been rendering to the Ministry of Health. Nonetheless, furthermore, as I said, the contribution of MRC cannot be underestimated, because if you look at the health system delivery, the government alone cannot do it. And we need participation from the community members, UN partners, and people like MRC. And as I said, MRC has been contributing our human resources and also technical assistance to the Ministry of Health, and including research, because you cannot do any intervention if you don't do any research. So the research conducted by MRC is greatly helping us to know what is really the causes affecting our human health. And by knowing that one, we are going to at least come up with solutions that MRC are coming out to support us. So I'm urging all of you, those here, to make sure that we sensitize our people to participate in research, because without research we cannot make headway. So some people may give a negative impression about researches. Some will tell the other people that they are trying to sell your human parts. Some will say they are trying to sell your blood. All these things will come, but with media sensitizations, people need to be well informed to make informed choices for the benefits of this country. So I thank MRC for the contribution they have been doing to support our health system. And once again, they have been, as I said, they have been contributing immensely to strengthen our health system. And this is why we are here today to inaugurate one of the structure they have constructed in Banjulnding Health Centre. Not only in Banjulnding Health Centre, they have done it in Brikama, they have done it in Fajikunda, they have done it in Basse. So I can say we are partners in development. So we will make sure that we give MRC the necessary contribution, support they need in order for them to function as a unit. So on behalf of the Minister of Health, as I said, I don't want to bore you with a long speech. I want to congratulate MRC for the wonderful job they have been doing and urge them to make sure that they increase their human resource development as they have been doing.
Good afternoon. The Honorable Alcalos sitting with us, the village community leaders, the UNICEF representative, and the delegates from other organizations, the Dr. Nyasi representing Ministry of Health, and the MRC senior officers and junior officers and all MRC staff and the village community and the mothers who are here today to mark this celebration. This is another important milestone for MRC because it shows and it's a manifestation of fulfilling one of our mission of really working with the community and stakeholders in order to improve lives through health services and health delivery. The building that is actually instituted here, which is a clinic and a clinical trial facility, increases the space of a clinical trial that has now been replicated again, because we've done this in Birkama, we've done this in Fajikunda, we've done this at the Serakunda Kanifing Hospital, we've done this in Sukuta, and all is to actually complement government's effort, as Dr. Nyasi says, in strengthening health system in this country. And we are really proud for this receptive gesture that the community has actually shown, and they've actually demonstrated their commitment to always participate and work with us in order to fulfill our research mission. And we are really grateful to you people, especially sitting here as study participants. We are also grateful to the Ministry of Health for always willing to collaborate with us in actually fulfilling either any structural building that we could do in any facility. We are also grateful for them to always listen to what we could do with them and give their support as much as they can. Dr. Nyasi mentioned the support that they could always give, ask for MRC, that MRC will never hesitate to give, but this is our role. We cannot work alone. We have to work with the Ministry of Health in order to fulfill our own mission. And we are proud that this is being increasingly recognized and strengthened day by day and year by year. And to say that we will be celebrating our 75th anniversary of existence in this country by November, and hopefully we are planning as part of the activities to continue to go to various areas where we have been very active in research, and tell the people that thank you, we appreciate this relationship that we have built with you people. So I think this milestone of getting this building is nothing but a pride for Banjulnding community, because it's their own, it's not MRC's own. So, and we want to share that ethos of ownership, that shared ownership, because without that shared ownership, research will not be able to be done effectively. So we are very much particular about people accepting and owning what we do with them. And this is strengthened more by even our ethics ethos, where we make sure community and study participants are protected, they are informed adequately of what we want to do with them. So I think we've come a very long way in people understanding MRC's mission, and not only that, but strengthening that relationship. And that is what we are proud of in this country. In all African institutions where there are international research institutions, MRC is always being quoted as one of the strongest research institution that is quite very much inclusive. Inclusive in the sense that we have built a strong relationship with communities. So without further ado, I think I will just end my speech. As much has been done, and the thank you messages have been delivered already by Cham, but I want to reiterate my thanks to our committed staff at MRC, because we people at the leadership level are highly dependent on them delivering, and they are the real front line and the workforce. And we have been very impressed with the commitment that our MRC staff have shown in order to accompany us in fulfilling that mission of improving lives in the Gambia and in Africa as a whole. So I would like to thank the MRC staff, and this is reflected by what the moving speech that Mr. Ba has just said. I've known Mr. Ba since 1993, 92, when actually I joined MRC as a postdoc then, postdoctoral fellow. And what they have described about him is actually, I can reinforce that these are the true qualities about this man. But there are many of the MRC staff who equally have shown this sense of commitment and this sense of love for working with our people in order to achieve MRC's mission. So I would like to thank you very much and encourage you more in how you're doing your work and delivering your work. So without further ado, I would like to thank again the community leaders who are present here and the delegates who are here, as well as the representative, director representative of the Ministry of Health. I thank you very much.